Hi, I'm Laura with Aspen University. Do you mind if I do a health assessment on you? And if you do, I have two consent sentences. First, do you give verbal permission to participate as a model in this assessment assignment and be recorded for school purposes for Aspen University Class N495?
Yes.
This assessment is indicated to show my skills with the assessment actions only and is not to be used as direction for your health status or follow-up with any irregular findings. Do you understand this?
Oh, yes.
Okay, well, let's have a seat here and let's get some vital signs real quick like. Okay.
Go.
So let's get a blood pressure on you here. Normally I would use a bare arm, but I'm going to put it up here.
Well, would you like to have a bare arm?
No, that's okay. We'll just go like this, okay? There we go. Okay, so hit it. Okay. And I'm gonna need a temperature under your tongue, please. Thank you. While I'm doing this, I'm counting the respirations.
I think we're supposed to turn this on.
There you go. And I'll take my, get a pulse here. Okay, very good. Okay, got my numbers, so I'll be writing those down here. So I wrote down your blood pressure, and I have your pulse and respirations, and I do not have a saturation monitor, so I'm going to check your capillary refill. Fingers are nice, pink, warm, and dry, and brisk capillary refill. Your alert and oriented ×4, pink, warm, and dry. So we're going to start the assessment, but I'm going to go wash my hands first, okay? So I'll be right back.
Alrighty.
So,
Right there?
you. Yeah, I think I said my ABCs. Alrighty. Okay, so we're first gonna inspect your head, face, okay, and neck area. So, do you know any problems with your scalp or your hair or anything like that?
No.
Okay, so I'm checking for flakes or bald spots. You told me about that one there, okay? And I don't see any lumps. I don't feel any lumps. And size of the skull is about normal, and the shape is normal for Miss GP. Facial expressions, you seem to be just cooperating and smiling, so you seem pleasant today.
Okay, thank you.
I don't see any facial edema or anything like that. And masses or lesions, I can just normally touch and feel rough spots for like lesions and stuff. So maybe a few little things. And the color is pink and warm, and it's dry. Okay, you can hold. So we're going to go on and assess the carotid artery. Okay, so I'm going to palpate it here with my two fingers. Right there by the throat, and I feel it. It's nice on both sides. Never do both of them at the same time. And it's nice and regular. Yep, it's nice and regular. And the temporal artery runs up here, so let's see if I can palpate that one too. I'll try on both sides. Yep. The rate corresponds with the carotid arteries. Okay, great. Yeah. Okay, so I'm going to palpate the thyroid now. So I'm going to place my fingers just below the cricoid, which is right about there. Okay, I'm going to feel for the thyroid isthmus. Why don't you swallow and see if I can feel it rise up and down. Swallow. Okay, good. I'm going to displace the trachea to one side or the other and see if I can feel it. Okay, any tenderness or anything? I don't feel any nodules.
No.
No soreness. Okay, the
No.
trachea is midline, so it's not deviated to one side. You can follow. Cranial nerve number 7, we're going to have you raise your eyebrows. Good, good. Okay, smile, frown. Good. Close your eyes tight. Good. Okay, great. All right. We're going to test the peripheral vision. we're gonna check the confrontation, which detects any lesions in the anterior and posterior visual pathways. So we're gonna do this with the static finger wiggle test. Okay, so I'm gonna face you about an arm length. I'm gonna have you stare at my right eye with your left eye, and close your other eye, right eye. Okay, and then I'm gonna stand up and just kind of like this, and tell me when you can see my fingers moving.
No.
Now, okay, great. Okay, now let's do the same thing with the other eye. So look at this eye and close that eye. There you go. And we're going to do the same thing, okay? Tell me when you can.
No.
Okay, good. We're going to check the corneal light reflex. So I'm going to use this pen light, hold it about 2 feet away, and I want you to stare at an object about 15 feet away. Go ahead and look at that post out there and don't take your eyes off of it. So I just want to see if you have equal gaze. Okay, so I'm just going to do that. Okay, good. All right. We're going to check for cranial nerve number 3, which is the pupils equal reactive and to light accommodation, okay, with consensual response on the other one. So I'm just going to put this light to your pupil and see if it constricts, but I should have a little constriction with that other one too. Yep. Yep. Okay. Good. Okay. All right. Good. The ears. Okay, we're going to palpate the external part of your ears. Okay, so I'm just going to feel for any lesions or any dry spots, any tenderness, and look on the outside, any redness or sores or edema. I don't see any. Okay, we're going to inspect the internal ears now with my otoscope. Okay, so I'm going to take a hold of your auricle and just kind of pull it slightly up and out, but not so much to where it hurts. Okay, I'm going to use the largest eye speculum that I have and put it on the end of the scope, ear speculum. Yeah, I'm going to put it down in there nice and gently, and then I'm going to just check for all the redness and swelling and drainage and see if there's any blood or any pain or anything like that. And then I'm going to do the same thing to the other ear. I'm going to check that and put that. There you go. Okay, all looks good there. Right. We're going to look at the nose on the external side, okay, and check for any lesions or any spider veins or anything unusual, deviated septum. I'm going to assess the frontal or the maxillary sinus. Any pain here?
No.
No. How about up here in the frontal sinus?
No.
No. Okay, I'm going to get my little otoscope out again and use the largest speculum. Put it and go up the nose just nice and gently, see if I see anything abnormal, deviated
Spiff.
no, septum, and nothing up there. Okay, so no swelling, no inflammation. Okay, right, we're going to inspect the mouth, so open up nice and big, okay, with the color in there, nice and pink, okay, and any ulcers, I don't see any. I'm going to put this down here, not gagger, okay, say aw, so I can see your uvula move up and down. Oh, that's nice, okay. Let me look at your teeth and see if they're, oh, they look great. No dentures, huh?
No.
Good, okay. And color of the tongue is normal, no blood or anything? Okay, great. So let's test the uvula again, okay? So open your mouth. Say, ah, put that down there. Watch it go up and down. Okay, that's great. That's cranial nerve number 4 that we just assessed. Okay, good. It should. Okay, we're going to assess her thorax. So I'm just going to check for the rate and the effort. Quality of her breathing seems normal. Okay, I'm going to come and do the posterior side, so you can come around. Okay, and then I'm going to place my thumbs close to about the 10th rib. Okay, right here, and I'm just going to kind of slide my thumbs toward the spine, and go ahead and breathe in there and out, and so I can detect how much my thumbs move in and out as far as amount of respirations, and determine if they're even. So this is called lung excursion. Okay, and I'm going to palpate the posterior thorax. I'm going to check for 4 levels, which basically right here, okay, down here, circle the scapula, I got her arms crossed in front. I'm going top to bottom. Okay, say 99 and just keep saying it.
99, 99,
Okay.
99, 99,
Oh.
99,
Oh.
99.
Okay. I'm gonna palpate the 4 levels, which basically circle the scapula around here. So you got your arms crossed in front, so I'm gonna go from top to bottom. So when you say 99, just repeat it.
99,
Okay.
99,
4 levels.
99,
Okay.
99, 99,
Okay, so I'm using both hands to
99.
check for symmetry and the frematus.
90.
Okay, right. So continue with the posterior thorax. I'm going to percuss using my left meter finger. I'm going to have the part firmly on the skin, and I'm going to tap with this one at all 4 levels and assess the differences. Okay, this is helpful if you want to determine fluid-filled or air-filled consolidated sides of the lung. And we're going to percuss the CVA, which is the costrovertebral angle. It's over the kidneys at the angle next to the spine, so it's right about there, okay? So, and you got one. Okay, good. Okay, so we're going to auscultate the posterior thorax in the 6 levels. So each time I put my stethoscope on your back, take a deep breath with your mouth open. Okay. In. In. Ideally, I would put this on the direct skin. But for demonstration purposes, I'm just going to do it over the shirt. Okay? So with this, I'm going to note the intensity, the pitch, and the duration of the inspiration and expiration and see if they're similar. And they are. I'll take the carotids for bruits, and so if you can stop breathing for about 15 seconds, and I can hear the turbulent airflow, and I'm going to use the diaphragm of my stethoscope. So I'll stop breathing. Okay, good. Okay, stop. Okay, so we're going to also take your chest, okay? The heart sounds, the S1 and the S2. So I'm going to start with the mitral, which is at the apex of the heart, which is right here. Ideally, close off. So the S1 and S2 are for the diaphragm. And then we're going to go over to the tricuspid, which is the lower left sternal border right there. Okay. And then the pulmonic, which is up second intercostal space, okay, right here. And then we're going to go over to the aortic, which is the right second space. So I would use the diaphragm for the high pitch S1, S2, and then the bell for the lower pitch and murmurs. All right, so we're going to inspect the abdomen. Ideally, we'll have a gown on, okay? So the contour, scars, any bulges, any tenderness anywhere? No?
No.
Okay, so what I want to do is auscultate first. So I'm going to listen to the bowel sounds on all 4 quadrants. I'm going to check if they're hypo or hyper. Okay. Lower quadrant. Uh-oh. Quadrant. So we're on the abdomen, and what I want to do after I auscultate, I want to palpate all 4 quadrants. So I'm just going to kind of do it 3 times each on each quadrant. Any pain or discomfort?
No.
No? Okay. Oops. 3. 1. 3. No. Okay. Any pain there?
No.
Discomfort in there? Okay, great. Well, To the abdomen, so I'm going to inspect the abdomen. Ideally, we have a gown on, okay? So I'm going to look at the contour and look at any scars or bulges. Is there any tenderness in your bowels or belly? Okay, so I'm going to listen first, all 4 quadrants. So ideally on the bare skin, and check for hypo and hypoactive sounds, or none. Okay, and now, next I'm going to palpate all areas 3 times each. Just kind of press down. Any pain there?
No.
Any over here? Any pain?
No.
No. Okay, how about down here?
No.
No. Over here?
No.
Okay, it's nice and soft. That's good. Okay. We're going to inspect all the extremities now. We're going to check all the joints. I'll just go from top to bottom. So I'll bet your shoulders. Any pain?
No.
No. Down here in your elbows?
No.
Your wrists?
No.
Okay. Hips?
No.
No. How about your knees? You can lie. Down here in your ankles? Alrighty. Can you shrug your shoulders up? Move them. Bend your elbows okay. Put your wrist around. Your hips, pick them up. And your knees work, and your ankles. Okay, great. All right, good. So I want to rate the strength of your muscles. So why don't you squeeze my fingers? There we go. Oh, yeah. Oh, whoa. Okay, good. All right, we're going to palpate and check for the pulses, okay? So I'm going to check the radio. Here. Radio, see if they're equal and strong, okay? And then I'm going to check the dorsalis pedis. It's on top. Take the little shoe off. There you go. Right here, 2 fingers. Good. And then the tibius, what is that called? Posterior tibial. I'm going to palpate that one too. Okay, nice and strong, all of them. So I would rate that between 0 and 4. Rate the strength of the pulse. Observe some of the neurological signs. So go ahead and walk down the path here, okay? And then stop and you can turn around. Good. Okay, come my way. Okay, good. You can stop and turn around. Good. You can walk heel to toes, like this. Down the line a little bit. Okay, good. Can you turn around? There you go. Can you walk on just your tippy toes? Okay, and can you walk on your heels? Okay, good. Alrighty. So we're going to test the Romberg test, okay? So we're going to stand with your feet together, okay? There you go, good. Okay, and you're going to open your eyes, okay? And then you're going to close your eyes, okay, for about 30 seconds. So I'm just going to notice any sway in or anything like that. Okay, that's 30 seconds. Good. Your reflexes, I'm going to check the brachial one first. So I'm going to put my thumb here, okay? And just kind of tap it with my reflex hammer that I don't have, but this will have to do, and then you'll go, well, not that much, okay? And then I'm going to check her patellar reflex, just on the patellar tendon, right there. And knees just have to be slightly bent, okay? And it's right below the patella, so, okay? With my reflex hammer. Good. And then I would rate that, the strength or the quality, from a 0 and 4. Okay? So that's good. Stop. Do the cerebellar test, so I'm going to assess that. So go ahead and just hop in place a little bit. Oh, good. Okay, good. All right. And then additionally, we're going to see if you can bend a little bit shallow on each leg, or, with your legs down like that, and then up. Good. Okay. So can you sit down and raise up without using the arms? Sit up. Okay, go ahead. Good job. Okay. And then if you had a stool here, you can probably step on that real good and steady. Okay, well, I think that's it. This concludes our health assessment.